name is Chris Galler with the Minnesota Realtors. Thank you for joining us in this e-video resource. Today we're going to talk about health insurance options, and with me today is Eric Andersen with the Minnesota Health Insurance Company. He's a broker of products and he has the ability to help some of our members. But before we get to that, we're going to kind of do an overview of the problem and the situation. As you know, the Affordable Health Act passed a few years ago. A lot of people know it as Obamacare. In Minnesota, they adopted what's called MNsure, which is a state-dependent program. Some of you may be enrolled in it now. Some of you are using independents. There's lots of ways to go. As you know, in late September of 2016, the rates came out. The rates came out significantly higher, anywhere from 40 to 65% higher than what they had been before. We also found out, because of less insurance company, that there's a narrower marketplace. So some of you may have lost your doctor, some of you may have lost their clinic going forward. We've been working on trying to find ways to solve that. First and foremost, there's nothing going to be fixed right away in 2017. The program itself is both a state and federal program, so that means both groups need to be in alignment. Then you have to get the insurance companies to be able to offer products. We do believe that there will probably be some action from the state legislature related to rebates. We don't know how much the rebates will be. We don't know if they'll be means tested or not. So we don't know all of the details. We do know there's a big problem out in the marketplace, and we're going to survey you to find out what your issues are. As time goes on, we're going to be asked at the national and state level to testify, and during that testimony they're going to want to know, how are your members impacted? Paul and Ryan here and the lobbyists in DC are going to need to know that, so we want you to answer that truthfully. And then in the next week we'll get that survey out to you, so please submit it and fill it out for us. Beyond that, the reality for right now is we don't have a fix for some of you that have very, very high premiums. And when we say high premiums, $2,000, $2,500 a month. One member from southeast Minnesota, $43,000 next year they're looking at having to spend for health insurance. That's ridiculous. And we've been talking around trying to find solutions. We were fortunate to get in touch with Eric Andersen here, who's a broker, and he's going to give us a conversation about those of you that are organized in LLCs, C-Corps, or S-Corps. Those are who we're primarily focused on today. So Eric, thanks for joining us. We really appreciate it. Can you tell us about what LLCs, C-Corps, and S-Corps will be able to do with insurance?
You bet, you bet. The options that you're going to be looking at as a small group, if you are an LLC, S-Corp, or C-Corp, and you've been established more than 6 months, you do have the ability to set up a small group plan, even if it is only one person or one family. That is definitely unique to the market. A lot of you aren't used to seeing that, and it's something that right now the small group market is about 30 to 50% cheaper on premium. It gives you much larger network options, including anywhere you want to go, as well as the Mayo Hospital. And it's a much more stable environment. So it's something that we really want to spend some time on and look at. And I can tell you without a doubt, if you are an LLC, S-Corp, or C-Corp, and you've been established more than 6 months, you need to at least look at this. Okay.
And there's in the plans that you've discussed with me, there are various deductible levels as
Absolutely.
well.
Yeah, there's probably 50, 60 options out there. There's 3 different network options. One is narrow, one gives you access to everybody except the Mayo, and one gives you access to everybody including the Mayo. The deductible options are as low as $2,500 individually, as much as $6,550 for the high deductible plan. They all have access to HSAs. That would not change, and yeah, whatever that you're used to having right now, we have access in the small group market.
And how about those people? We've got a number of members that probably aren't set up in an LLC, not set up in a C or S Corp. They're still going to need insurance.
Correct. Yes. What we've kind of determined is about 40% of you are not an LLC, S Corp, or C Corp. For those, what we want to do is have you contact us still, and we would want to run you through MNsure to see if there were any tax credits available. Right now the tax credit, because maybe you haven't qualified in the past, you definitely would be able to qualify today. We can run you through there and have you take a look at that. Also, what we would recommend is, because of that 6 months, maybe what we would have you do is contact your accountant, see if an LLC, S-Corp, or C-Corp works for you, have you set that up, and maybe in 6 months from now, we could look at doing a small group plan, or if nothing else, in 2018, have that option for you.
Perfect. So, for those of you in the marketplace, if you're an LLC, a C-Corp, or an S-Corp, we have a second video for you to watch on how to get quotes and find out some about the rates. If you're not set up as a LLC, a C-Corp, or an S-Corp, you can contact Eric's companies, whose information is on the screen, and talk to him about MNsure, and he can walk you through the programs, or his partner Andy can. We thank you for joining us today. We hope that you have a great week.
Thank you.